Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Before I share the local numbers of people infected with COVID-19 in Windsor-Essex and surrounding communities, I want to highlight the importance of adhering to the key public health messages we have been sharing throughout the pandemic. People are instructed to stay home during this time. Maintain a physical distance of 2 meters when out for a daily walk or for a necessary grocery run. Wash your hands often with soap and water. Cough or sneeze into a tissue and discard the tissue in a lined garbage pail, or sneeze into your arm if needed, and then wash your hands. And clean and disinfect surfaces regularly, including doorknobs and light switches. We cannot overstate the importance of all of these measures. Thank you to all of you who are doing your part. Your continued efforts are needed to help stop the spread of COVID-19. We have been receiving a lot of calls from concerned residents about those not adhering to public health recommendations. If you have concerns about restaurants, bars, tobacco and vape shops, please contact the Windsor-Essex County Health Unit, and we will follow up. Reports of non-essential businesses being open, people not physically distancing, and people gathering in groups larger than 5, please contact 311 in Windsor or your local municipality bylaw office in the county. Reports of people not adhering to self-isolation orders or quarantine orders based on travel should be reported to the non-emergency line for police services. These people will be reported to our health unit for further follow-up, which can include an order under the Medical Officer of Health. I will now share our daily updates. We now have 15,512 confirmed cases of COVID-19 in Canada and 4,038 cases in Ontario. Chatham-Kent has 12 cases and Sarnia-Lambton has 79 cases. Michigan now has 15,718 cases with 4,495 cases in Detroit. We now have 204 confirmed cases of COVID-19 in Windsor-Essex. 27% of our cases are between 50 and 59 years of age, 41% are male, and 59% are female. We are currently working with 6 long-term care facilities that are experiencing COVID-19 outbreaks. The health unit continues to follow up directly with everyone who has tested for COVID-19, both positive and negative results. Those that are awaiting results are to remain in self-isolation. Overall, 1,534 individuals have been tested for COVID-19, and of those tested, 148 tests are pending. Testing for COVID-19 should be based on clinical assessment. Where there are shortages of testing kits, then the following groups will be prioritized for testing: symptomatic healthcare workers and staff who work in healthcare facilities, symptomatic residents and staff in long-term care homes, hospitalized patients admitted with respiratory symptoms, symptomatic members of remote, isolated rural and Indigenous communities, and symptomatic travelers identified at a point of entry to Canada. Please continue to visit WECHU.org for the most current information and case counts. Many of our frequently asked questions are posted on our website. If you are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary health care provider for a phone assessment or a virtual assessment if available. They will guide you for next steps, including contacting public health or attending an assessment center. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning. Just over 2 weeks ago, Windsor-Essex County Health Unit reported the first confirmed COVID-19 case. We now have 204 confirmed cases of COVID-19 in Windsor and Essex County. The sudden rise in confirmed cases are attributed to delay in receiving the results from the public health lab in the beginning, but as the lab capacity increased in the last weeks, the results are coming back in a timely manner. Right now, there's 148 tests pending, which is a good indicator that many of these test results are coming back within 24 to 48 hours. The other cause of these increase could be attributed to community transmission. Just like many of the communities in Ontario, we are also dealing with COVID-19 outbreaks in long-term care homes, retirement homes in our community. Managing these outbreaks is a priority for the Windsor-Essex County Health Unit. Our staff are working closely with these homes to ensure that appropriate measures are in place to control the outbreak in these facilities. The staff and leadership in these facilities are doing a great job to manage the outbreak and put control measures in place to prevent further spread in these homes. Over the weekend, CDC recommended that all citizens start wearing homemade cloth masks when going outside. The CDC indicates that the use of cloth masks in public where distancing is difficult to maintain, such as grocery store or other public settings. In Canada, to date, there is no recommendation for the public to wear masks when going outside, but I also do not want to deter residents from taking all appropriate precautions to protect themselves and others. Given the concerns of shortage of personal protective equipment, healthcare workers should have access to surgical or procedure masks and N95 masks as a priority. Healthcare workers are the ones who are at the front line, and we should leave all these essential supplies for them to keep them safe, to keep the hospitals and healthcare system running. For everyone else, if they are considering the use of homemade masks, they need to take the following steps. Before putting on a mask, wash your hands with soap and water thoroughly. Secure the elastic loops around your ears. Ensure the mask completely covers your nose and mouth and there are no gaps. Do not touch the mask while wearing it and remove by the elastic loops or ties. Wash your hands thoroughly and throw away in a secure and proper way. This is important. You should not leave it discarded in a way which puts other people at risk. If it's a washable one, please wash in a washing machine with hot water. Most important, the best protection from COVID-19 is to stay home as much as possible. Ensure physical distancing from others, minimum of 2 meters at all times. Wash your hands regularly and thoroughly. Do not touch your face, nose, mouth, or eyes before. At this stage, if you are someone who think you have COVID-19, please contact your healthcare provider for a telemedicine assessment. Our primary care group colleagues have really worked hard to arrange telemedicine consult for their patients. Your doctor can make a determination if you need testing or make referral to the hospital or to the assessment center. I continue to urge you, please do not go outside if you do not have to. If you do go outside, always maintain a distance of 2 meters from each other. Physical distancing is a very important measure and it can make a difference between life and death for some. Look after your family members. Look after your neighbor. Support them while still maintaining the 2 meters distance. Please be safe, do your part in protecting your community, and break the chain of transmission. Thank you.
We'll now take questions from the media. We'll start with AM800.
Are you advocating for the use of homemade masks? I know Canada is not making a recommendation, and you gave some advice there about wearing it. So are you encouraging people to do so?
At this point, I think the risks and benefits for wearing a mask is on the side that people, if they choose to wear, we're not recommending it, but recognizing that we are a border town, many of the people are watching what's happening in the U.S. and around the world, and if they choose to wear that, those are some of the recommendations from us. I'm not advocating that everyone should be wearing a mask at this time.
Why not, given the fact that community transmission is a concern and wearing a mask prevents others from getting the virus if by chance you are asymptomatic and you have the virus? Why not encourage that then?
Well, there are if people start to use these masks properly, I think that's better. Homemade masks are not as effective as many people think. It gives a false sense of security. Many people, when wearing the mask, may think that they are safe, and they may take some of these measures which put them at risk. Touching your hands while wearing a mask could be a problem, because now you're exposing directly this mask to potential viruses which you are coming in contact with. So I think we need to recognize that yes, there could be some benefit, but there could be some risk that could come with it. So as long as people who are wearing it, they recognize that risk, they make sure that they're taking all these measures to ensure that they're not putting themselves at risk. And I think that's the key part. People shouldn't be getting into that false sense of security that if they're wearing a mask, they're safe and protected. That's what my concern is. But recognizing that many people, there are a lot of changes that are happening, and people may actually use the mask safely. If that is the case, then they can use it. And again, once the reminder from CDC is the mask will still not save you from contracting the virus, but it will prevent some of these early pre-symptomatic phase. If you are sick, then it can protect others instead of protecting yourself. So I think people need to understand that the mask is not the one solution to everything that we are talking about. Your best measure still is the physical distancing piece. If you are in a situation where you cannot maintain those physical distance, then wearing a mask could provide additional benefit for you.
Thank you.
Any questions from Blackburn?
Yeah, I just mentioned that I just want to clarify about the testing. So I know it's 148 tests. So are all those tests within the last week? Can you say that? Have we caught up on the large backlog that was still previously?
So we have caught up with more of those testings, and I cannot give you an exact breakdown, but the test results are coming back very quickly, especially if they belong to one of those priority group. There may be few that are still outstanding, but majority of those tests that were in the backlog, we cleared all of that, and we are getting more recent results now.
Any questions from Windsor?
With the increase of 20 additional cases today, are any of those at those long-term care homes?
So the cases that we have seen, it's a combination of the community and long-term care home. So it's a combination of both.
Any questions from CTV?
I think I'm good.
Any questions from CBC?
4 cases of healthcare workers from work in Detroit.
So can you please repeat your question again?
Of the 204 cases, how many are healthcare workers who work in Detroit?
We provided our epi-summary breakdown last Friday, and we will do it one more time every Friday, so you can expect to hear more from us. But what I can say is at least 30% of the cases that we are seeing in our community are healthcare workers, and further breakdown, the healthcare workers between Detroit and here would happen on Friday when we are compiling all those results after collecting data from all the positive cases.
Okay, and how many of those healthcare workers from Detroit are hospitalized here in Windsor?
I am not sure that any of them are hospitalized, but I'll have to check back, and I'm not aware that if any of them are hospitalized at this point.
Okay, and seeing someone email in concerned that mosquitoes may carry COVID-19, do you have any information if that is a possibility?
Right now, there is no evidence that mosquitoes can carry COVID-19. So we're just, I guess we'll have to wait and see if it changes. But right now, there is no evidence to say that mosquitoes can transmit COVID-19.
Okay, and can we just go over one more time when people should be calling in if they see infractions, which infractions they should be calling in about?
So I'll invite Teresa Merita to give that detail again.
I'll just recap the information I spoke about earlier. So if you have concerns about restaurants, bars, tobacco, and vape shops, you contact the health unit, and we will follow up. Reports of non-essential businesses being open, people not physically distancing, and people gathering in groups larger than 5, then we're asking people to call 311 if you're in Windsor, or the local municipality bylaw office if you're in the county. Reports of anyone not adhering to self-isolation orders or quarantine orders based on travel recommendations or requirements, they should be reporting those concerns to the non-emergency line for police services, and they will follow up with the health unit, and possibly, if needed, we can issue an order under the medical officer of health.
Thank you.
Any other questions?
I will follow up, I guess.
Can you indicate how many, well, we're hearing about people not social isolating. We were hearing about there being a big group of people over at Cemetery Garden along the waterfront this past weekend. Are you hearing those same concerns and complaints?
We do get a lot of calls, but we are streamlining it, the complaints, and working with law enforcement. So they have, auxiliary police officers out, and they've increased their focus as well under the Emergency Management and Civilian Protection Act. So I think you'll see more and more of enforcement out in our community. We do get calls. We continue to receive calls, but we are trying to address them the best way we can. But we really are relying on our law enforcement, both in the city and in the county.
Do you know any of those
What kind of penalties? What kind of penalties do people face for violating the orders?
So with the law enforcement piece, it can be between $750 to $1,000 or further penalties. And regarding if we were to issue an order under Section 22, which is an order from the medical officer of health, it can be $5,000 a day. There are also higher penalties for those that are part of corporations or businesses, and they're like thousands, tens of thousands. Oh, 25,000 per day.
So I guess the regular flow now is that if people have complaints, they call 311 or, cop shop, and then if it gets to a point where it becomes serious, then you guys are notified, and then proper steps are taken after that, right?
For people that are supposed to be self-isolating, so if you've had a test, you should be self-isolating immediately, and or if you're positive. So if we hear of reports and through the police, we will follow up, or sometimes they're coming to us directly.
Any other questions?
Do you know any of those orders or fines have been levied already?
I do know that our health unit has issued some orders regarding some businesses through our own health unit tobacco enforcement officers.
So businesses that are open that shouldn't be?
Yes.
Okay.
One last one. Sure. Just curious, do you know how many people have recovered?
We don't have the
Do you know the exact number?
I'm looking at our epidemiologist, but we might not have that exact number.
We have received a lot of feedback about posting that number, and we will look to do that on the website.
All right.
16? Oh, 16 people have recovered,
Oh, yeah.
according to our epidemiologist, Ramsey.
But we'll verify that on the website.
Yeah, okay. Thank you.
And we will update our website to make sure that information's up there.